Hi, philosophers. So, some of you in the mid semester survey wanted a little more talk about and connections to COVID. And so, I talked about it just a little bit in the epistemology video a few weeks ago, but I wanted to go through some of the connections between different branches of philosophy, and possibly some of you may want to use COVID as your main topic for your final project, which would be perfectly acceptable. So, just start keeping your eyes out for those connections between particular topics within COVID, or sort of COVID as a whole, as you're experiencing it and as you're reading things online, and also making sure that you're keeping an eye out for fallacies when you're listening to other people talk about it, when you're listening to politicians or anybody writing or out there in the public talking about this particular issue, right? Because there's a lot of misinformation and there's a lot of information that's contradictory. And so sometimes weeding through that can be quite difficult. But I think looking back through the fallacies is a really helpful way to go at, what to take in and what to leave, right? So I want to go through just a couple of fallacies that I've heard recently, and then through connections to different branches, so you can kind of think back to where we've already been and then kind of ahead to where we're going, and keeping an eye out for the philosophy that's showing up in this pandemic. So some fallacies that I've heard recently, well, the ongoing one would be sort of around masks, right? So one would be that masks can make you sick, right? I've heard a lot of people who don't want to wear masks making such a claim, right, that you're sort of breathing in your own, right, carbon dioxide, and that's not healthy for you. Well, that would be suppressed evidence, right? So we have quite a bit of evidence that healthcare workers, your dentists even, right, have been using PPE for a really long time, and that there's no evidence to suggest that for most people that there's any damage, right, that the mask can do to you in wearing it. So think about those healthcare workers who are doing surgeries for hours and hours on end, 12-hour shifts, and so on, okay? And even for your grocery store workers and all those people who are wearing them, right, almost their entire shift, you know, what does that say? Are we suppressing evidence there that, again, wearing masks doesn't provide protection? Now, if the claim is wearing masks does not provide you full protection from getting, right, COVID, then yeah, you have a claim there, right, with some legs, because obviously the mask has to be worn in conjunction with other health measures. Washing your hands, right, making sure as soon as your mask comes off that you're washing your hands and not touching the mask again if you've been out, grocery store shopping or whatever it might be. But if the claim is that wearing a mask helps provide protection, right, not only to you and to others, the evidence suggests that it does, right? So just making it a sort of blanket claim that because it doesn't provide 100% protection, that it's not a valid choice, would be a fallacy of suppressed evidence. And then another one you sort of heard, I think at the very beginning, especially when we were going into lockdown, but I think it's a kind of an ongoing conversation, is whether or not it's the economy or controlling the spread of the disease, right? And many, not only public health officials, but also economists would say that's actually a false dilemma, because those two are so intimately linked. So early on, we were told, right, by those who had sort of studied pandemics more in depth, that we could either take a really hard hit in the beginning, right, economically, or we could do what we're doing now, which is a much more long and drawn out process where we sort of feel as if we are, opening up the economy, and yet we're still going to be on a very long road because we didn't want to take that hard hit in the beginning. So that I would argue is a sort of false dilemma between economy and the spread of the disease, right? The more the disease is around, the more it's going to affect our economy, and you see that by the layoff of jobs, right? From everything from Disney to local restaurants having to close, or airlines, and so on. Right, so the longer it goes on and the longer our patterns have to be changed, even though the economy is sort of quote unquote open, means the economy continues to suffer, right? So we can't deal with the economy without dealing with the spread of the disease. And then just any claim about without evidence, right? You could just consider that kind of a blanket suppressed evidence if you're looking for one of the fallacies to name it as, but always looking for where is that evidence coming from, okay? Another one would be I think it was during the debate, but I think I've heard it elsewhere from the president and other people sort of saying, COVID is China's fault, right? Now, if the claim, right, if the argument you're making is, right, whose fault it is it, where did it come from, right, then again, you might have something to stand on. But if that's the response to the question of what should we do, right, and have we done enough in the US, then you're actually using a red herring, right? So if you're trying to divert attention from the actual question being asked, and this is done right throughout debates, you probably saw it definitely in the first debate, on both sides in the vice presidential debate as well, right? You're asked one question, you answer a totally different question, right? You divert attention. So anytime you're doing that, you're using a red herring. So be on the lookout for that. So on to metaphysics. So the one question, and you could use this for all kinds of different topics. So if you're looking for how do I connect, right, the area of metaphysics to ethics or to epistemology or sociopolitical philosophy, and a lot of you did your essays on this, you can do that question of God's existence, right? And why would a God allow anything evil, right, or suffering to happen in the world? Right, so you could take that metaphysical question, and then it could give you multiple kinds of answers, right? It could give you the atheist answer that God doesn't exist because such a God wouldn't allow that. It could give you that answer of free will, which was quite popular among you. And it could give you the answer that perhaps God has different attributes, right, than we thought. But it doesn't matter kind of where you end up there, right? You still have to answer the question, now how do we act? Right? So if you're atheist, humanist, you still have to answer the ethical question. Okay, well, given that this didn't come from God or anything, right, that's personified, right? It came from nature. We still have to answer the question, the ethical question, how do we act? And the political question, how do we arrange, right, the state to respond? If you answer free will, again, if it's on us, it's not on God, then we have to answer the ethical question about how do we respond, and how do we take care of one another. And then, if God has different kinds of attributes, then we might think about, right, if God is sort of in response to us, God is creator but also created by us, then how do we want to continue to shape God through our actions, right? So again, attached to ethics. In epistemology, so I talked about that a little bit in that video, we always have to answer the question, how do we judge those claims made about COVID, right? What are the criteria that we're using? And so correspondence theory is going to be pretty limited in that it can give us the actual data, right? We can say yes or no. There's, when we do a study, there's particles in the air or there's not, right? When somebody's wearing a mask. So we can make some statements about that are helpful, but we really are going to have to go to something like the pragmatic test, even the creativity test, when we're sort of dealing with questions about, well, what does this mean? What should our approach be, right? What's the sort of truth about what we should have done, right? So again, when you're evaluating political claims, right, in presidential debates, correspondence theory is not going to get you very far because those aren't the kind of claims that they're making, right? So you have to use, sometimes coherence might work a little bit, although there's real limits to that because both sides could have a very coherent to them narrative, and deciding between the two is going to take something else. It's probably going to take a pragmatic approach to truth, and even that sort of view creativity, does it produce life, approach to truth. And then where we are now, social and political philosophy, there's lots going on. One of the things I want to think about is this question of, are we a free country? So a lot of the debates around masks revolve around this claim of, we're a free country. I should be able to do whatever I want, right? I should be able to wear a mask or not wear a mask. And if I get sick, then, right, that's something I'm taking on, with my freedom. Now, the thing to keep in mind that the social contract theorists are going to remind us is that we're not completely free, right? Anytime you are in a social contract, that you are part of a state, right? You've already given up some of your freedoms in order to have others protected, right? And have sort of basic flourishing, right, protected. So anyone who claims, right, this is a free country, right, is actually ignoring that they are already a part of a social contract, right? They abide by, or hopefully they abide by, um, you know, rules of the road, right? They stop at stop signs, right? They don't say, I have the freedom to go through a stop sign. So we have all of these measures in order to protect ourselves and protect others. And so this idea that we're completely free ignores, right, that entering into a social contract in order to protect and live hopefully longer lives, if we're going in terms of Hobbes's basic argument there. The next idea I want to think about is how COVID has exacerbated inequalities. Um, and thinking in terms of the U.S., but you could, whatever country you are at home in, you could think about the specific inequalities that might have been exacerbated there. There's certainly gender inequalities, right? So who's taking care of children, and so that division of labor that is there is has certainly been exacerbated, and there's been studies done that have shown that a lot of women, right, their careers will suffer for years, right? That you just simply, it was hard to do it all before, but if you're trying to work from home, right, and raise children and do all of these other things, it's that much harder, right? When you're teaching your child from home and they're on Zoom and various other things that are happening. And that's if you still have a job, right? That's if you still have all of those other things in place. And then certainly racial disparities, right? So by and large, Black and Latino communities have been hit much harder, and so that sort of raises up what are some of those systemic inequalities that were already there, and then COVID sort of brought them out and brought them into just starker relief. Okay, so thinking about some of those kind of general things, also thinking about healthcare, right? Who had access to healthcare before, right? And then if you lost your job, right, during the pandemic, what kind of access to healthcare do you have? Education, right? So you have some families who were able to really invest, right, time into their children, having to learn, right, from home. But others were still working, right? Not everybody had the ability to work, or still has the ability to work from home and help their children, right, while they're learning. And not all school systems have the same resources to help students, whether that's in class or online learning. And so that exacerbation of educational inequalities has been there, definitely in jobs, right? Who got fired quickly, or put on furlough, who got a little bit of help from the government, but now has been waiting around, right, and trying to pick up jobs here and there. So who's been most vulnerable because of job insecurity. And then I even thought the other day, right, even something like transportation, right? So if you didn't have a car, right, but you're lucky enough maybe to still have your job, right, working in some sort of service industry, then you're taking the bus, and you're in more and more contact with other people, so you have a higher possibility of contracting COVID than others might be who are lucky enough to be able to work from home and have a car to get other places. And so again, who's exposed more. Okay, so just looking around and thinking about what were those inequalities that were already there, and now how does COVID bring those to light even more. So one question to think about is, what does a just society look like? Okay, how much relief do we give people, and where do we pull that from, right? So there's some who argue, right, that the government should only do so much, right? That people should be able to pull themselves up out of the situation in the meantime. That we should be relying on sort of private resources, churches, and other kind of nonprofits to help people through. And that is, I think, in stark contrast to other approaches which say, no, that this is sort of the government's responsibility to allow its citizens to make it through this pandemic. And so you have very different approaches. When you look again at that chart and to the theories of justice that come up in chapter 9, think about, right, what does it mean to allocate different kinds of resources during this time? Really depends on your philosophy, your social philosophy about justice, okay? Now, I also want you to think about, there's a lot of talk about, oh, can we get back to normal? What would that be like? Wouldn't that be amazing? But perhaps this is a time in which we can think about getting to a new normal, right? So if we're coming, sort of all of these inequalities are coming to light or coming into relief, right, in a really, really powerful way, is this a chance to think about, should we be investing in different things, right? In terms of job security, right, in our economy, where do we invest in terms of healthcare, right? Should that be a universal right or not? Housing, which seems pretty basic, but if you've lost your job and there's the stimulus package only went for so long, and a lot of cities are no longer doing stopping evictions or doing rent relief and so on. What do you do for folks that do not have access to stable housing, which means it's a lot harder to have access to education, right? All of these other things that you hope your citizens have, right? So that we can as a whole flourish, but also individually flourish. And then also thinking about environmental impact. So it's just listening in the radio today, they were talking about the one sort of silver lining of this is that we've had this kind of reprieve. The environment has this chance to breathe and do a little bit of recovery. And so do we want to go back to the old, right? Or do we want to use this time to think about a new normal for the environment that we actually all share? When you move on to ethics, and these are going to sound in some ways very similar, the kind of social philosophy questions are also very much linked with sort of ethical questions about what ought we do, right? But think about who gets resources, who gets something as simple as a ventilator if we only have so many, or time with doctors, or particular kinds of drugs, right? That's an ethical question that we have to ask. And so is it, no, everybody deserves the same right treatment regardless of who they are, kind of almost duty-based ethics that you're going to see in Kant. Is it sort of a utilitarian approach? What's going to be best for the greatest number of people, right? Is it going to be kind of Aristotelian virtue ethics, which means it's going to be different for different situations and people? So finding that balance between two extremes, right? So maybe it's not everybody gets the exact same resources, but it's also not, right, only a few people get the very best. What would that middle point look like? And also thinking about, at the very beginning of the pandemic, I had certain students who had to work, right, and had to go out, and other people who were able to quarantine completely at home, right? So when you get to Aristotle's means between the extremes, think about his claim that it's not one and the same for all. It's not a one size fits all ethical theory, right? It depends on what are the two extremes in your particular life and situation. And then also thinking about the Buddhist idea and their ethics of us being interconnected and what it means to show compassion. Because as we show compassion to others, we're showing compassion to ourselves. And that, I think the pandemic brings that into pretty clear focus, right? That the virus actually connects all of us, right? We are breathing the same air, we're breathing in the same particles, right, that people are breathing out into the air. And so in that way, we are not these sort of isolated individuals in the way that oftentimes Western thought has the individual sort of separate from one another, and Buddhism helps us to think about the ways in which we are interconnected in that net, right? And the sort of dark side of that is that a virus connects us together as well. So, how do we respond ethically to that with compassion? So, I hope this was a little bit helpful, and maybe you have other thoughts and other connections that you're making with COVID and the material that you're reading. If you do, please use the discussion board and let me know what your ideas are so I can respond, give you feedback, and maybe this is something that you use as your final project topic. All right, see you later.